Let's now go to identification of patterns. Let's discuss characteristics of symptoms and signs. Symptoms and signs in Chinese medicine have a rather different meaning than in Western medicine. They are different from a relatively narrow area explored by Western medicine despite its battery of laboratory tests and scans. Instead, the doctor of Chinese medicine widened his or her view to assess changes in a broad range of common bodily functions, in addition to the presenting symptoms, such as urination, defecation, sweating, thirst, and so on. Furthermore, the doctor of Chinese medicine takes into account many clinical manifestations ranging from certain facial and bodily signs to psychological and emotional traits, which are not really symptoms or signs as such, but rather expressions of a certain disharmony. Many of the clinical manifestations contributing to form a picture of an underlying disharmony would not be considered as symptoms or signs in Western medicine. For example, absence of thirst, inability to make decisions, a dull appearance of the eyes, thirst with desire to drink in small sips or small ears, all of which are meaningful manifestations in Chinese medicine, would not be considered as such in Western medicine. Thus, whenever the words symptoms and signs occur, they should be interpreted in this broad way. Over many centuries of accumulated clinical experience by countless doctors, Chinese medicine has developed a comprehensive and extremely effective diagnostic system and symptomatology to identify disease patterns and the underlying disharmonies. Chinese medicine takes into account many symptoms and signs that would not be such in Western medicine, that is, inability to take decisions, small ears, dull eyes. Thank you for your attention.